Joe, can you tell us what the problem is that you're experiencing?
I'm a breast cancer survivor.
Okay.
I have back pain, neck pain, TMJ.
Okay.
You name it.
All right. When you say breast cancer survivor, that means you beat it
Yes.
and it developed in either the right or the left breast?
Correct.
Which one?
Right.
In the right breast. Okay.
So,
Just for conversation's sake, what I'm going to do here is kind of lay out the program that the body's trying to follow. I want to tell you what your body's trying to tell you, and then we can go from here and determine where the situation may go, may take us. Okay. First of all, a difficulty with cancer is a problem with the cell mechanism, and especially in the right breast. I've got to ask you, is there any difficulty in the past few years here with family? For example, mate or some type of what do you want to call them, partner?
there's been deaths in the family.
Yeah, okay, all right. So as far as, let me refer you to a website, germannewmedicine.ca. Dr. Reiki Hammer is a German physician, has come up with a novel idea, and I have seen this hold true, that women especially with problems, with difficulties with mates or with partners will develop a tumor or cancer in the right breast. If you have a problem with your children or nest, it'll develop in the left breast.
Oh, interesting.
Provided, of course, you're right-handed. If you're left-handed, it's just the opposite of that.
Right-handed.
So, okay,
Okay.
all right. So let's say that there are a number of circumstances that need to be set up for cancer cells to start to develop. I would venture to guess we have a problem going on here that let me test your body just to confirm what I'm suspecting. Can you get up here on the table for a sec?
Face up.
Face up, please.
Okay.
Okay. All right, now I'm feeling the neck and I got it. All right, you can't see this on camera, but there is a bulge in the neck. The vertebrae should stack on top of one another, and this one is kinked so that the bulge sticking out there is the vertebrae sticking out, but the problem is the spinal cord going down through here is being pinched. Okay, so what this is going to do for us is pinch the vagus nerve, which powers your digestive system. So I'm going to assume you have some type of digestive disturbance.
Sure.
Yes, okay. All right. I'm going to also further assume that there is a problem with your liver circuit. Somewhere in your family gene history, somebody had either diabetes or alcoholism or hepatitis or something.
Diabetes.
Okay, confirmed. All right. Let me tell you what I'm trying to explain here, is that in energy medicine, the liver is in charge of the integrity of connective tissue in the body, okay? So with a weak genetic liver circuit, which this body would have from the gene pool above, there then would be a risk factor for hernias, tears, sprains, strains, prolapses, sagging connective tissue, okay? The diaphragm here is a parachute-shaped muscle that separates your chest cavity from your abdominal cavity. There's a hole in the diaphragm that lets your esophagus go through. That's your food tube. It goes from up here down into your abdominal cavity. Because of the risk factor for hernias, for tears, I'm going to assume again that in your particular case, the hole in the diaphragm has stretched or torn and some of the stomach gets sucked up into the chest cavity sometimes. So I'm going to ask you, sometimes do you get heartburn?
Not too much.
Not too much. In other words, the answer is yes. Okay. Do you also feel little pitter-patters in here sometimes?
On occasion.
On occasion. So the answer is yes again. Sometimes do you feel maybe there's a pill stuck in your throat sometimes?
Oh, yeah.
Oh, yeah. Okay.
A lot of times.
Sometimes it feels like somebody's sitting on your chest when you take a deep breath?
Occasionally.
Occasionally, okay. So that confirms my suspicion here that what we have is another case what Western medicine calls hiatal hernia. The hiatus is the hole in the diaphragm. The hernia, of course, is the tear in that hole. And we're dealing with the diaphragm and the stomach. So there's an interaction between the diaphragm, the esophagus, and the stomach. By the way, volume 3 of my book series deals with hiatal hernia. It tells all about it and how to deal with it and what to do with it. All right, so in this particular case, what's happening is your stomach is being literally pinched. So it is physically damaged, and because of that, it is swollen and irritated. It cannot produce the enzymes and acids necessary to process your food. So whatever you do put in your mouth does not get digested properly. In other words, a lot of it, well, any organic material stays in a warm, dark, moist place for a period of time. It's going to rot. Okay, so if you don't have enough hydrochloric acid in your stomach to suspend that rotting process, that's exactly what we'll do. So we end up with a compost pile here in your stomach. And that goes all the way down, and more than likely, there's going to be some pain between your shoulder blades, yes? Right in through here?
Yeah.
Yes, okay, because this particular muscle in the back between the shoulder blades is powered by the same energy circuit that powers the liver. And the liver is in trouble, so this muscle is going to be in trouble, so it's going to hurt. You also have some low back pain into here. The low back pain, again, is, by the way, have I ever seen you before?
No.
No. I just want to make that clear. The low back pain in through here then is the result of the large intestine running into trouble because it's receiving all this garbage from the stomach. Small intestine gets down into the large intestine, and then the large intestine works overtime. It wants to get paid time and a half, just like you do when you work overtime. So it goes to this muscle back here for extra energy, goes to this muscle back and through here, so you get aches and pains down through here too. Yes, yes, yes. And this condition will continue basically for the rest of your life, no matter what you do. Western medicine doesn't really have anything that's viable. Any supplements that you might take don't go very far. The reason for that is the stomach is injured. And it is not going to heal unless we physically move it out of its present place down back where it belongs. It's up here where it doesn't belong. It's being constricted. So I want to show a little demonstration here.
Okay.
First of all, I want to see how strong this muscle is over here. I want to do that by pushing down this way. Hold up real tight. Push back against me tight. Okay, now hold this right here with this hand and hold up real tight again. Yeah, okay. Now, was there any difference in the strength?
Yeah.
Yes, it was weaker this time here.
Yeah.
Excellent. Okay, put your hand back down again. That's good. So that confirms to me anyway, because I know what the body's trying to tell you. I know that the stomach is definitely in trouble. Now, by the way, I just wanted to show you what happens when this neck is pinched. See if you can lift both legs without bending your knees. Can you do that? Nope, back down again. Back down. Okay, without bending your knees this time.
No, I can't.
Can't do that. Okay, so I want to just put a little extension pressure here, just for a couple of seconds. And now try to lift. Ooh, look at that. Okay, so when we take the pressure off of the spine, that relieves the energy can go down and power the muscles. Okay, so essentially this is what we're dealing with. There is also going to be a corresponding problem with the pancreas. That is going to, because the pancreas is in trouble, it's also going to affect your sugar balance. Your sugar balance then is responsible for mood swings up and down. Yeah. Okay, so in addition to all that, there will be digestive disturbances, and it may actually end up with a problem back up in your butt. Could start to pinch back up into here, and you get a toothache all the way down your leg.
Oh, wow.
Those are the things that can develop. So there is a way out of the weeds. I'm not going to do it on camera right here, but you can pull this down. Mm-hmm. Once you do that, your stomach can heal and all these other symptoms can go away. Okay?